Right. Yes. Good morning, everybody. Welcome. Thank you so much for being here. We really appreciate it. My name is Maggie Shewack, and I'll go ahead and introduce myself first. I work in the VA healthcare system. I am in the Transition and Care Management Program, which maybe you have heard of and maybe you haven't. And it's okay either way. We're going to touch on a lot of stuff today. But I am the outreach specialist for the Phoenix VA. And I'm very excited that I could be here to share some info with you about the VA, some programs that we have to offer, how does the healthcare system work, and what we're going to ask for this session. If you have questions throughout, I'll be sharing a PowerPoint. Eddie will also be sharing a PowerPoint. If you have questions, please just go ahead and drop them in the chat box. And then towards the end, we will jump into all of those questions as well, unless we have any from the start. So if you have any questions right now that you have been wanting to ask and you haven't been sure where to ask them, go ahead and put them in the chat box now and we can address those before we get started. Eddie, if you want to go ahead and introduce yourself.
Yeah, good morning. My name is Eddie Fuenmayor. I'm double teaming here with Maggie today to provide some information about the regional office of VBA, benefits side of the VA. And again, I will be having a slide presentation as well and hopefully taking your questions at the end of the session. Unless you have something currently, please drop that question in the chat box. Maggie?
All right, so I don't see anything lighting up right now, so we'll go ahead and jump into our PowerPoints. And for the sake of time and just the way that this breakout session is formatted, we're kind of gonna go through the slides a little bit quicker than we would like, just so that we can get the main information out there and then take questions based on that. So yes, as you have questions, go ahead and throw them in the chat. I'm gonna go ahead and share my screen. Oh, I love that there's captions at the bottom. This is so cool. Give me 1 second. All right, let's jump into it. I hope that everybody can see my screen. There should be a PowerPoint that says Phoenix VA Healthcare System. And all right, let's jump into it. So like I said, I work for VHA, or the Veterans Health Administration, and I will go ahead and distinguish the different organizations that we have. Some of this might be just repetitive information that you've heard a million times before, or maybe it's brand new. So I hope that you can take something away from it either way. So the Department of Veterans Affairs is broken into 3 different giant sections. And I think that this is important to understand because it really it will help determine who you should be reaching out to if you have specific questions, whether you're a veteran or a family member of a veteran, if you are currently active duty, whatever the case may be. So we fall into 3 different categories. So like I said, I work for VHA, or the Veterans Health Administration, and this is everything hospital related. So all of your VA hospitals, community-based outpatient clinics, or CBOCs, anything that you can think of related to primary care, mental health, specialty care, your emergency rooms, all of that falls under VHA. So if there are questions specifically related to the healthcare system, that would be going to me, and I will make sure that you have my contact information by the end of this presentation, by the end of this breakout session. And then we have the Veterans Benefits Administration, or VBA, and that is Eddie's specialty. So that's what he's going to be talking about today. And this is all of the benefit services that we have to offer. So anything related to education, so like your GI Bill, VA home loan, service connection, disability, all of that falls under VBA. So if you came to me and you had a question about your service connection, I can give you some general information, but more likely than not, I'm going to go ahead and send you over to the people that work at VBA, because they are the experts, and I want to make sure that you're getting all of the correct information. And then we have our National Cemetery Administration, or NCA, and they handle everything cemetery related, burial information, being able to plan for end of life care. That all falls under NCA. Again, if you came to me with questions about that, I can give you some general information, but I would prefer to send you to the people that know how to answer those questions best. Oops. And a little bit more about VBA, which I'm kind of going to go through this pretty quickly because Eddie's going to touch on this in a second. All right, a little bit more about healthcare. So oh no. The VA operates the largest healthcare system in the country, and we have more than 1,400 medical centers and clinics across the country. And we're portable, right? So if you live in one place in the US and you decide that you're going to move to another place, you can easily transfer your care. We try to make that as seamless as possible. And that's kind of where I fall into transitioning care management for those that have recently separated. If you're coming off of active duty and you are moving to a brand new spot in the country, sometimes that's very overwhelming, but we want to make it as easy as possible. And because all of our medical records are electronic, any VA can access them. They can pull them in from other VA centers so that we can make sure that you have that continuity, so you're not constantly telling everybody over and over again about your medical history. And once you are enrolled in the VA system, you remain enrolled, and you can stay wherever it is, whether you're staying at your current VA or you're moving. Once you're enrolled, you're in the system, so there's no need to worry about being, kicked out in any way. To make an appointment, so there's a couple of different ways to do this. I've got some phone numbers down here to make those initial appointments. Like I said, I'm also going to make sure that you have my information. So if you have general questions about that, you can reach out to me. But making an appointment, pretty easy, calling into, again, the main hospital here in Phoenix and getting those appointments scheduled. Couple of different ways to enroll in VA healthcare. The bottom line is we just want to make it as easy as possible. So whatever is easiest for you, chances are we have a route that works best. So if you prefer to do things through the internet, you can always go on to www.va.gov. You can apply for healthcare there. They're going to ask you some basic information, and then the process will continue from the specific hospital that you are working on. It's technical difficulties. What's going on? I hope everybody can still hear me. Nope.
We can.
Perfect. Thank you. I'm getting some weird messages here. I apologize for that. If you would prefer, you could call into the main number, that 1-877 number there, so that you can enroll over the phone. And then again, the enrollment process will finish out at the specific medical center that you are enrolling into. You can walk in person to enrollment and eligibility, and this is at every VA hospital across the country. For our main hospital, we're the Carl T. Hayden Medical Center. We're down on Indian School Road in Phoenix. And then finally, last but not least, if you would prefer to send in a 1010-EZ, which is our enrollment form, you could go ahead and print that out. You can send that in the mail. And then as you can see there, that address is where you would send that 1010-EZ, and they would go ahead and complete your enrollment from that point. There's a couple of different, oops, I'm so sorry. There's like all these different notifications going off. There's a couple of different parameters for eligibility purposes, and there could be a lot of questions on this. So if you have a specific question, go ahead and throw it in the chat. And if it's very specific and very nuanced, I'll make sure that I reach out to you personally afterwards. For our eligibility, this is for active military service separated under any condition other than dishonorable. If you have a dishonorable discharge, there's not much that we can do with that. But if you do not have a dishonorable discharge, you may qualify for VA healthcare. And there are some caveats for members of the reserves or National Guard. So if you are in the reserves or the National Guard and you were called to active duty by a federal order and you completed that full period of active duty service, then you can receive that eligibility through the VA healthcare system. Other than honorable discharges, so if you have received an other than honorable discharge, you can still receive emergency mental health care services for 90 days if that care is initially sought through the ER. And during this time frame, there are some different things that we can try to do to upgrade that discharge status. I'm not saying that that's always possible, but it's worth trying for. And there are a lot of exceptions to the minimum duty requirements. Again, this is a very broad overview. So if you have specific questions about this, please, feel free to reach out to me and we can go over that a little bit further. or if you are in the Phoenix area, you wanted to walk into the hospital, enrollment and eligibility can help with this as well. Our mental health services, let me start here, community-based outpatient clinics, or our CBOCs. So these are satellite campuses to our main hospital. Not everybody lives close to the hospital, and we understand that. So we want to make sure that care is accessible no matter where you live. So a couple of different outpatient clinics that we have, as you can see here, we have 7 of them, 7 or 8. And I have their specific addresses here. Again, once you go through the enrollment process, eligibility will be able to help you determine the closest clinic to where you live. Our mental health services that we offer, we have mental health services offered at our main hospital and every outpatient clinic. So at our main campus, we have the Jade Opal Clinic, that's our mental health clinic, and it is open Monday through Friday, 8 a.m. to 3:30 p.m. And there are walk-in hours during normal business hours. So if there is an emergency if you're not going to the emergency room, but it's mental health related, you can always walk into the Jade Opal Clinic at our main hospital. And we also have our emergency department, which is open 24 hours. If there is a crisis, please call 911, or if you wanted to call the veterans, our Veterans Crisis Line, that's 1-800-273-8255, and then press 1 to be transferred over to that line. Our Substance Use Disorder Clinic, or our SUD Clinic, we have walk-in screenings available Monday through Friday. We do offer intensive outpatient programs. We work with justice-involved outpatient, if that's something that is court mandated. And then we also have outpatient needs as well. And for those that are seeking inpatient treatment, that is an option. Again, I'm going over this very broadly just so that we can get kind of the umbrella picture, and then we can break down everything in any questions that might be brought up. Our CRRC, so this is specific to veterans that are experiencing homelessness or are at risk of homelessness. So we work the CRRC works with the Healthcare for Homeless Veterans Program, or HCHV, and this is where everything related to housing goes through the CRRC. So if a veteran is seeking transitional housing, if they are looking for long-term housing or sober housing, as it could be called, they do clinical screenings there to determine the level of need. What is the eligibility that the veteran has to receive services? What services are they eligible for? And we do have access to medical, mental health, and substance abuse care, and there are peer support services as well. And with the CRRC, they do collaborate with community partners to be able to kind of bridge those gaps that might be, sometimes, there are hurdles for those facing probation or financial issues. So we work with community partners to ensure that the veteran is getting all of the care that they need related to housing through the CRRC. And as you can see here, some of our other specialty programs that we have available, basically anything that you can think of, the VA has it. So if, again, related to housing, we do have housing programs available. We work with veterans to either help them find employment, or there is a program called the Compensated Work Therapy Program where they actually work at the VA as they are getting employment coaching and working on the next steps. We work with those who experience military sexual trauma, or MST. Our Transition and Care Management Program, which again is where I work. So it used to be called the OEF-OIF program. We transitioned to Transition and Care Management, and we work with veterans that are coming off of active duty, transitioning into civilian life, and how can we best get them set up for success, getting all of their appointments in place, and making sure that they're comfortable with that transition from service member to civilian. We have mental health intensive case management programs. We have a PTSD clinical team, recreation therapy, caregiver support. And again, if you have any specific questions about this, please go ahead and drop them in the chat. Our dental program here is a little bit, there are some caveats to it. So you can receive dental if you're getting your DD 214 and it says on your DD 214 that you still need to receive one cleaning, you can get that one-time treatment through our dental program. And that's a very specific thing that's listed on your 214. Other than that, if you have a service connection for something dental related, or if you have a 100% service connection, then you are eligible for dental. Other than that, there's not too many ways that we can get you in there. If you have specific questions about that, I can go ahead and answer them. All right, so a little bit more about the Transition and Care Management Program, or TCM, which is where I work. So we do case management when it is appropriate with veterans who are transitioning off of active duty. How can we make sure that the goals that they have are, being reached, that they're getting the care that they need, and that they feel that they're properly connected to healthcare services after leaving active duty. And we do offer mental health services as well. We focus on that post-deployment and transitional and readjustment, those concerns specifically, because we understand how difficult it can be to come off of active duty and try to navigate the VA system. So we have medication management, we offer case management, and we are just connecting with those veterans who are coming to the VA for the first time and making sure that they're getting the care that they need. So we have what is called our combat veteran eligibility, and that's our 5-year combat vet status. So if you served on active duty in a theater of combat after November 11th, 1998, and you discharged under other than dishonorable. So again, dishonorable, there's not much we can do for that, but any other character discharge, if you qualify, for enhanced eligibility if you fall under this category. So that means that once you leave active duty, you have 5 years of care that is paid for by the VA, so you don't have any copays. There's no associated cost with that, and that's our combat veteran status. Being mindful of time here for Eddie. And also within our clinic, we do have the 7 principles for making marriage work. So this is one of our psychoeducational workshops that we offer for couples. Right now it's being offered through VVC, which is our VA Video Connect. So it's being done just like this. It's 8 weeks long. And if you have any specific questions about that, you can always reach out to me, or if you're already in the healthcare system, you can ask your provider about it, and they will submit that consult if appropriate. My Healthy Vet, I'll just touch on this a little bit, and we talk about this with every veteran that we reach out to that's coming off of active duty. So anything that you can think of related to your healthcare, filling your prescriptions, asking your provider questions, being able to check appointments, we do it through My Healthy Vet. So yes, of course, you can call into the hospital, but this is a much quicker and a much more efficient way to be able to access all of these things all in one place. So if you have not already enrolled in My Healthy Vet and you are established with the VA, I highly recommend going online and getting set up so that you can get everything in one place. Our vet centers, so a little bit about these. We work closely with the vet centers that are in the Phoenix area. So we work with them, but they are different. They are separate from the VA. So I don't share my records with the vet center. The vet center doesn't share their records with me, but they are run mostly by veterans, and they offer counseling, anybody that's struggling with anything such as PTSD or MST. They have a lot of different services that they offer, and there are certain parameters for qualifying for the vet centers. And if you have questions, please feel free to drop that in the chat. A little bit more about the vet centers and what they offer. So again, some veterans, they may not feel as comfortable coming to the VA, and they may still want to get certain parts of their care, especially when it's related to therapy. And that's why we work very closely with the vet centers to get them the help that they need. Our crisis line, as I mentioned earlier in this presentation, anytime that there is a crisis and you need somebody to talk to, please call the crisis line. And somebody will answer and talk with you and make sure that you're safe. All right, so I'm going to stop sharing my screen And I'll let Eddie go ahead and get started. And I'm gonna look through the chat and start getting prepped for any questions that have come through. So thank you.
All right, Maggie, thank you for that. Just a ton of information there. Great job, Maggie. And we have some questions in the chat box, but we'll address those at the end. Like I said, my name is Eddie Fuenmayor. I'm a supervisor here at the regional office here in Phoenix, and I'm going to do a quick presentation. Our breakout session is till 10:25, so I want to kind of run through this, and hopefully we can get to some questions, which is probably a little bit more important. So we can go to the next slide. Real quick, this is our VA mission statement, something that we're pretty proud of, to fulfill President Lincoln's promise to care for him who shall have borne the battle, and for his widow and his orphans by serving and honoring the men and women of our America's veterans. That's our VA mission. We're pretty proud of that, and we stand behind that. Next slide. The VBA is broken down into 4 different districts, the Northeast, Southeast, Continental, and the Pacific. Here in Arizona, we are part of the Pacific District. This is just kind of some mapping. Next slide. Here's the map, kind of coincides. Obviously, the Pacific District is that west side of the map. Depending on where you fall, that's the district that you would that would be processing your claim. Next slide. Disability compensation is the biggest one. It's a tax-free benefit paid to veterans for injuries incurred or aggravated during service. Any veteran who qualifies, any veteran who served under conditions other than dishonorable, and veterans who have current disabilities due to injury, disease, or psychological, incurred or aggravated by active duty service. Disabilities range from 100 to from 0 to 100. That's kind of where it becomes monetary after 10%. It's a combined rating, so it's not separate ratings. So like if you have a back, neck, and an ankle, and each of them are separate, we don't add them together. There's a formula that we use. It's a bit confusing, but nonetheless, it's a combined overall rating. Compensation payments, obviously from 10 to 100%. 0 is non-compensable, but it's free medical care for that condition at the VA hospital. There's additional allowance. So let's say you reach 30% and you're married or you have children. We can pay you a separate dependent fee benefit for that. Next slide. The original claim, obviously, the first time you've ever filed a claim is the original claim. A new claim is a claim we've already established benefits, or you've already filed a claim and you want to file a new one. Increased claim, obviously, you've already been receiving compensation and you think your condition is worsened, and therefore you find an increased claim. Secondary claim is filing a condition that is secondary to the one that you're currently service connected for. So kind of example, I have bad knees, I'm service connected for each knee at 10%, and the knee condition is causing a back condition. So the back condition would be secondary. And a supplemental claim is a claim filed to provide new evidence to support a disability. So if you were denied and you feel like, hey, I have more additional evidence to provide or new evidence, you can file a supplemental claim. And all these forms, all this information is available at va.gov, how to file a claim. va.gov is a big website. It's got a ton of information of all the benefits. So, you could probably start there. Next slide. Individual unemployability is paid to 100% rate. Basically what that means is if you are 60% for one condition or combined at 70%, and your conditions prevent you from gainful employment, then you could receive the benefit called individual unemployability. So basically it maintains you at the 60 or 70% range, but it does eventually, it pays you out as if you were 100%. There's some limitations to that. Obviously, if you're receiving this, then you're not entitled to work, or if you work, it's got to be below a certain amount of money, very little. But that's the compensation. So if your service-connected conditions prevent you from gainful employment, then you can apply for IU and hopefully get that benefit. Special monthly compensation, SMC, is paid for veterans who are service-connected disabilities. We pay additional as a result of military service incurred or the loss of use. So let's say your service-connected disability is your right arm, but is significantly injured and you have loss of use, meaning you can't use it. We're not talking about it's painful or the range of motion is painful. This is like, we can't use this arm anymore. Then there's an additional benefit besides the service-connected percent that you're going to get. There's an additional benefit called special monthly compensation due to the loss of use, and that's paid separately. Clothing allowance, if your service-connected condition, maybe you have to wear certain creams or certain devices or braces, and it wears on your clothes, you can be entitled to clothing allowance. That's paid through the hospital and the prosthetics department, I believe. Next slide. Automobile allowance, again, it's another benefit. Again, you got to qualify for this. If loss of use or vision, or there's certain stipulations for that, but we could give you a one-time allowance to purchase a car should you meet these criteria. And then the adaptive equipment obviously is like, if you need a chair lift or, we need to modify the interior or something like that. If you have the qualifying disabilities, then you could be entitled to that. Special adaptive housing along the same kind of lines. If we need to widen your hallways or add ramps to your house, you could apply for that should you qualify. And we can do that through the Regional Loan Center. Next slide. How to apply, basically you can use an accredited attorney, you can have a claims agent, you can have a veteran service officer, i.e. DAV, American Legion, Vietnam veterans, all these people to assist you to file a claim. You can use an intent to file. An intent to file is basically a marker. Basically, you submit a form, the 09995, or I'm sorry, 0996, and you can submit this form, and basically we will hold your place for 1 year. So basically you submit this form, and 6 months later, you eventually file a claim, submit the proper form and evidence. If we grant service connection, we will take you back to the intent to file date. A fully developed claim is also another benefit. This is kind of tries to speed up the process, meaning you submitting everything up front. No further information or evidence is needed from you after this, and we will process the claim as quickly as possible based on the evidence submitted. Again, va.gov, great site. The application, the standard application that we've been using now is the 21-526EZ. It's the standard one that we use. It could be used for inquiry, secondary, or initial claim. We also encourage you to become familiar with evidence requirements so you have the complete understanding of not all VA responsibility, but ours, yours as well. So, obviously this is the address where you need to send your claim. The U.S. Department of Veteran Affairs is the claim intake center. It's our contracting vendor, and they scan all the information. Obviously we're electronic now. We're not really paper anymore. We're trying to maintain paperless. And so this is where you would send the information. Evidence requirements, obviously, current diagnosis, current treatment. If you're seeing a doctor, those are the things that we're looking for. And that's what the 4142 will do for you. If you're filing a claim for service connection for let's say a right arm, and you're seeing Dr. Johnson on a regular basis for that condition, if you submit the 4142, we will make a request on your behalf to request that evidence be submitted to our office. And all you have to do is just complete the form, and we'll take care of that for you. Next slide. How long the process will take, this is kind of one of these questions that we are unfortunately not able to answer. There's a lot of things, several factors, as you can imagine, that could, delay the claim and what's up. So the type of claim you filed, the complexities of your claim, the number of disabilities, the availability of evidence needed to decide your claim. So these are also lots of factors that delay the process or may delay the process. Also, keep in mind that VA, while we process the claim, we have a lot of separate other agencies that we are requesting evidence from that we don't house in our records. For instance, the service treatment records, those are owned by the Department of Defense. We don't have that. If your claim requires us to request Social Security records, we don't have that. We have to go to Social Security to get that. If you requested us to get your records from Dr. Johnson, We don't have those obviously in-house, and we're requesting that. So all these things delay. If you're claiming PTSD and we have to verify the stressor, we have to send that to a separate agency to verify the stressor. So there's a lot of things that could delay your claim. But should none of these things affect your claim and it's just a standard normal claim, probably 120 to 180 days. Next slide. VA pension is an additional benefit, as a different benefit besides compensation. VA pension is paid out to benefits based on need for conditions not incurred or aggravated by service. And obviously there's a income threshold that needs to be met as well. A couple of the basic stuff, obviously, other than dishonorable discharge, you serve 90 days of active duty in a wartime period, and the countable income that is below the maximum annual percent range, pretty low. Meet the following. These are a couple of things, not totally, but these are probably the requirements we're looking at. 65, permanent total, patients in a nursing home due to physical or mental incapacity. You're receiving Social Security benefits, and veterans who entered active duty September 7, 1980 must have served 24 months. So prior to that, it's only 90 days. After that, it's 24 months during a wartime period. Next slide. Special monthly compensation is also paid out for pension as well. Again, if your condition warrants you to, prevent you from moving around in the house, or it's subject to your limitations of daily life, we can pay special monthly pension. Aid in attendance is a separate highly monthly pension amount paid to veterans and surviving spouses. And housebound, obviously, if you're bedridden and stuff like that, we could if you qualify, we could pay you a separate special monthly pension called housebound. Next slide. The Fiduciary Program is another program that we have, and that these are for our veterans who, due to their service-connected conditions or not, are having some issue with managing their benefit. So we have someone who suffers from schizophrenia, and obviously, we need to step in and intervene to make sure that that money is being managed correctly. Fiduciary can be appointed through the Fiduciary Program, or you can elect to have a family member, your spouse, or someone to be your representative or your fiduciary in order to maintain your benefits and make sure that those things are managed properly. Next slide. And again, I apologize, I'm kind of rushing through these things. I want to get to the questions because I think they're more important. Vocational Rehab and Employment Program. This is a program that we have for service-connected veterans who are, because of their disabilities, prevents them from the job they used to do. And so we try to help them, by preparing them or getting them ready for another job. So, that might be, attending college, that might be, some career counseling, some resume stuff, some on-the-job training. We try to intervene here and hopefully that you become employable, and because of your limited disability, we can move you or transition you into something else. And so this is a great program for those veterans who are looking to employ but cannot do the previous employment they used to do based on their service-connected disability. So next slide. The Home Loan Guarantee, this is the Regional Loan Center. It's, this is where you could get, assistance for purchasing a home. It's a reusable benefit. The limit, the cost, it limits closing costs. There's a lot of benefits to using this benefit in purchasing a house. Like I said, basically we're, in a sense, the government is co-signing your loan. In a nutshell, that's what a home loan is. You need a certificate of eligibility. There's a process to request that, and you can check again the va.gov website. Next slide. The appeals of moderation. This is someone who already has a claim, and you disagreed with it. There's a process. You filed an appeal, and the Veterans Appeal Improvement and Modernization Act, it took effect on February 19, 2019. And what it does is it it gives you an opportunity to take to apply into three different lanes. So the higher level review lane, this is an entirely new review of the claim based on the experience of the adjudicator. Obviously, these will be our decision review officers. You can file a supplemental claim. So if you have additional evidence that you want to submit, you can file an additional claim, a supplemental. And then the appeal lane is the review by the standard regular appeal process. You file a claim, we deny you, you disagree, you file the appropriate forms for the appeal. And this obviously goes through the Board of Veteran Appeals. And if you want to appeal that, you can go to the CAVC, the Court of Veteran Appeals. Next slide. These are some of the resources that you could do. Like I said, va.gov, the benefits at va.gov, some Facebook, some Twitter, some social media stuff. And so these are the couple of numbers that you should. The 1-800-827-1000 is probably the best number. It's our national contact centers. They could assist you with all sorts of benefits VA-wide. Next slide. All right, again, I apologize. I kind of ran through that, but we only have a few minutes, so I wanted to make sure that we take some questions. So let's go into the chat room and see what we got. And I apologize if we don't get to your question.
Yeah, I could touch on a couple of these real quick, and I just want to reiterate, I know that some of this stuff feels very frustrating. I'm getting some of that frustration from these questions. I totally understand as a veteran that also gets care from the VA, and I'm hoping that we can make it better for the future. As far as the question about, Elizabeth asked about the TRICARE authorizations or the veterans authorizations being discontinued, that falls under the Mission Act or community care. So because that's a pretty complex thing, I don't know if I can answer all of that right now, but Elizabeth, if you are still on, please feel free to reach out to me after this so that we can get you pointed in the right direction. It's not my wheelhouse, but I want to make sure that we get you to the person that can answer that better. I did see the question about receiving access if a veteran does not want to use the VA system. I did provide a link for that, and I saw somebody else also gave a link to apply for access. That just goes through the regular access system. The traveling vet program, just to touch on that very quickly, the best way for a veteran to utilize that program if they are moving and they want to go to a different VA, the best way to get that started is to reach out to their primary care provider. So whether they do that through an appointment or they contact them through My Healthy Vet, being able to let your PCP know, here's where I'm moving, here's when I think I'm moving, and I would like to continue my care at that other VA. That would be the best way to do that. There are some local phone numbers to be able to reach out to ask questions. So again, if going through your PCP is not an option or it's not what you would prefer to do, please reach out to me after this and we will find another way. Eddie, do you have anything to add as I'm looking through these? They're great questions. I'm learning so much.
Yeah, we have a quick one. I think that's Bethany. Just bring up the chat. Yeah, the intent to file. Obviously, if you file an intent to file on January 1st of 2021 and you file a claim in February, we're going to go back to the intent to file. If you file a second one, you're going to need another intent to file. We're going to take the effective date of that second 5/26. Can I file a new claim and a secondary claim at the same time? Yes, you can. You can file your new claim back condition, and on that same form, you can request that your needs be considered on a secondary basis. Is there a list of veteran service officer available here in the Phoenix area? There is. We can get you that information. Anyone needing assistance with the claims process, feel free. Well, there you go. There's a number here. Someone, Reagan, putting out their number. Tried to apply for VA pension for my dad, and the process was a nightmare. Finally had to give up. That's unfortunate. I do apologize for that. We are not, unfortunately, here at the Phoenix Regional Office. We don't process pension claims. They're all done at the PMC, the Pension Maintenance Center. There's 2 locations, one in Philly and one in Wisconsin, Pennsylvania, one in Wisconsin. and they process the pension claim. The big thing with that, I can tell you, is that you need to provide all the information at once. That's the big stickler with that. Excuse me, is that you need to provide information. If you're missing something, they're going to deny it, and it does take a while. And unfortunately, that's unfortunate for you. I would definitely recommend that you come back, come by our office when we are open, and we can assist you with that for sure. My name is Danny and Kim. I went to the AZ Department of Veteran Affairs, helped with my claim, and the person I talked to gave me the paperwork, told me to fill it out and bring it back, and they would file it for me. They did not help at all. It's unfortunate. Again, you could come here to the VA regional office here on Osborne and Central, and we could assist you with that. Again, all these service organizations, these are state organizations. They're not federal. They're not part of the VA. They're just agencies from the state that assist veterans. Most of them are great organizations.
Let me just jump into this one, Eddie, from a while ago. Somebody posted about having an issue with connecting to their specific CBOC because of the way that the calls are set up. And I totally feel your pain. I understand. I also get seen at a CBOC. The best way to get around this, instead of trying to call in to talk to your provider, especially if it's time sensitive, the best way to get around this is to set up and utilize My Healthy Vet. When you send a message to your provider using My Healthy Vet, they need to respond quickly. So instead of trying to call around and get to a certain point, I highly recommend using My Healthy Vet. That way everything is documented and you know that you're going to get a response as quickly as possible.
Maggie, why don't you look at the iPhone one? It's came in at 9:53. Hi, I was curious when the Phoenix VA will be allowing veterans to call clinics and CBOCs. Did we get that one?
Yeah, the best way as of right now is to go through My Healthy Vet, because it's not user friendly to try to call into a CBOC. I've had the same issue both as a provider calling a CBOC and as a veteran accessing care. So going through My Healthy Vet as a veteran is definitely the best way to do that until it changes, if it does.